Good afternoon, everybody. We're going to get started right now. We are running just a minute or so behind, but in the meantime, we have a video for you to watch. And I will play that for you right now.
ALS, Ice Bucket, bring it on!
ALS is a tough disease. It's not very well known. Creating awareness and being an advocate is what I wanted to do. Every August, until a cure.
ALS is also known as motor neuron disease. It's a disease that affects the motor neurons in the brain and the spinal cord. Those motor neurons eventually die, so this means that they lose the ability to walk. Eventually, they lose the ability to speak, and finally to breathe. And this has a devastating impact on the body.
What's going on in your life, it's nothing compared to what he's going through, not only at that moment, but every moment of every day. I'm proud of him, I'm proud of what he does, but I was proud of him before he had ALS. And he's an inspiring young man to a lot of people.
One of the hardest things about ALS is losing the ability to speak. I don't want to sound like a computer. I want to sound like me.
So to give Pat his voice back, we actually partnered with a tech firm called Lyrebird, who specializes in recreating the human voice from only 2 to 3 hours of audio samples.
The unique thing about Pat's case is that he didn't have recordings to work with, so we had to go on the internet and find all his speeches and all his interviews and basically take the audio from those. I guess in a sense it's really because Pat, he gave his voice to the ALS community that we're now able to give him his own voice back. We can't wait to hear what he's going to say.
Time to say goodbye to this computerized voice.
It's a strange feeling saying your first words a second time.
Oh my God.
Unbelievable.
Wow.
It's like you don't even realize how powerful, how personal, and just how unique your voice really is, until it's taken from you. My voice was how I fought back against the very disease trying to take it from me. Sorry, I'm not going out that easy. I will make sure my voice is heard again. Guess who's back, bitches?
We're so happy and grateful that Pat's going to be able to use his voice again to continue to speak for the ALS community and rally support for the cause.
We're already working on turning this into a larger program so that if you're diagnosed, you can record your voice and use it in the future. That way you will always keep that unique part of yourself, your voice.
If you have ALS, it's crucial that you do not wait, and that you start backing up your voice while you still have it. Thanks to Project ReVoice, I can finally speak freely in my own voice again. It's changed my life forever.
Can you hear me now? Okay. Hello, everyone. My name is, can you still hear me? I'm just going to hold it. My name is Danielle Bussey. I'm a study coordinator at UCSD in clinical research. I'm just here to describe some of the research we have going on at UCSD really quickly and briefly. One of the options that you always have, and Keith has this lovely poster, is the ALS registry. You can actually just type it into Google search, the ALS registry, and it should populate. You go on, you take about a 15 to 20 minute questionnaire just providing some history on family, medical history, a couple environmental questionnaires just to list your criteria and hopefully get some more information on ALS and what causes ALS. What's cool about this registry is it also links you to biorepositories, clinical research studies, fact sheets on ALS, just a bunch of resources that you can use at your disposal. There's also another registry called, it's on rdcrn.org, so that's the Create registry. It basically does the same thing. The main purpose of this is to link you to clinical trials. You fill out, once again, another 15 to 20 minute questionnaire just about some of your medical, familial, and history related to ALS, and then it'll populate all the clinical trials that are currently going on in ALS. You can search through exclusion and inclusion criteria and see if you're possibly eligible for any of them. Currently at UCSD, we have 2 trials that are open. One is a therapeutic study called Mallinckrodt. It's HP Athcar gel. It's a steroid. This is a 9-month study, so at each month interval, you're coming in for an inpatient study. We're testing efficacy, so that means we're testing to see if this gel, which is approved for lupus and rheumatoid arthritis, is effective in slowing down the progression of ALS. Some exclusion and inclusion criteria are 2 years from your screening, or 2 years or less of symptom onset. Also respiratory function above 60%. So your physician or your clinical team will usually do this in the form of a slow vital capacity. It's a machine where it just is measuring your total volume of oxygen you're storing in your lungs. Also, diabetes is exclusionary. Any cancer within the past 5 years, hepatitis, a positive result for HIV, all of those are exclusionary for this trial. Our second trial is non-therapeutic. It's called Create. This is an important study because it's a big symposium of data. The purpose of the study is just to look at all these data points that are collected and try and find biomarkers or genes that are linked to ALS that we don't know about, and hopefully develop a therapy that can target that gene or that biomarker. Keith, do you have a question for me?
Why is the registry important?
Why is the registry important? Well, for one, this is an orphan disease. That means that I feel like it just went. Am I good? That means that this disease is still not affecting a huge amount of people based off our population size. Based off, I think it's something like we have 50% or less of the patients that have ALS actually on this registry. That means when the government's looking at directing funds to certain diseases and developing certain therapies, we're saying that, I think it's 3,000 every year are diagnosed with ALS. We're saying 3,000, but it's only showing 1,500 or less. So they're saying, where are these patients? So it's important to log on and to get your data in there and register yourself as an ALS patient. So one, that we can collect new information on this disease and hopefully find, new things that are causing it. And 2, so that we get funding and people who are looking at this disease and investing time so that we can advance research. Yeah.
And how do they reach out to clinical research here in San Diego?
So, how do we reach out to us directly?
Yeah, how do they get a hold of you guys?
Well, our email, you can go on UCSD and you can look up the ALS group. There's contact there. My email, I guess I can spell it. It's going to be very long, but it's D as in dog, B, VAPOREAN BUSSEY at UCSD.edu. Or you can contact us by phone. My number is 858-246-0247. So any of those, you can use my contact. Probably the easiest way would be to go online and reach out to one of, I think, Dr. Rabbit's emails listed on there and a couple members of our team.
Okay. All right, anybody needs those numbers or email, just contact the ALS chapter. And we'll post them on Facebook so you guys have that. So, Danielle, it's always a pleasure to have you with us.
Thank you.
Thank you, and hopefully people will be in touch.
Yes.
We'll get to, this is a month we're really pushing the registry. We're trying to get everybody who's got this diagnosis to be in the registry. It really is important for research and the funding initiatives in Washington. If we tell them one number and the registry is showing half of that, we lose a little credibility. They don't expect it to match perfectly, but we can't be off by 40-50%. So that's a big push this month. We thank you for joining us. Just a couple upcoming events as our speakers are getting ready to begin presenting their presentation. We have some fundraisers coming up which help support our activities here in San Diego. For those who are interested, we have a fiesta at Valley View Casino and Hotel on May 30th. So if you want information on that, it'll be on our website and Facebook. There's a golf tournament for those who are into that kind of fundraising activity on August 24th at Sequan Golf Resort. And our major fundraiser of the year is our Walk to Defeat ALS, October 21st in De Anza Cove, Mission Bay Park. So we started off with the Project V-Voice video that came out this morning. Some folks are already familiar with Model Talker and other voice banking options. Looks like this is one of the latest and greatest. It's going to be free, probably more adaptive to apps and using your phone and so forth. So it's a great thing. And their collection of prior voice, in the case of this individual, worked real well. So if somebody didn't voice bank, but they want to hear their voice later, if you have recordings, apparently that's something they're able to handle pretty efficiently now. I'm going to speak a little more, James, and then we're going to do that video. Let's do the video again right now. Thank you.
ALS, Ice Bucket, bring it on!
ALS is a tough disease. It's not very well known. Creating awareness and being an advocate is what I wanted to do.
Every August until a cure.
ALS is also known as motor neuron disease. It's a disease that affects the motor neurons in the brain and the spinal cord. Those motor neurons eventually die, so this means that they lose the ability to walk. Eventually, they lose the ability to speak, and finally to breathe. And this has a devastating impact on the body.
What's going on in your life, it's nothing compared to what he's going through, not only at that moment, but every moment of every day. I'm proud of him. I'm proud of what he does. But I was proud of him before he had ALS. And he's an inspiring young man to a lot of people.
One of the hardest things about ALS is losing the ability to speak. I don't want to sound like a computer. I want to sound like me.
So to give Pat his voice back, we actually partnered with a tech firm called Lyrebird, who specializes in recreating the human voice from only 2 to 3 hours of audio samples.
The unique thing about Pat's case is that he didn't have recordings to work with, so we had to go on the internet and find all his speeches and all his interviews and basically take the audio from those. I guess in a sense it's really because Pat, he gave his voice to the ALS community that we're now able to give him his own voice back. We can't wait to hear what he's going to say.
Time to say goodbye to this computerized voice.
It's a strange feeling saying your first words a second time.
Unbelievable.
Wow.
It's like you don't even realize how powerful, how personal, and just how unique your voice really is until it's taken from you. My voice was how I fought back against the very disease trying to take it from me. Sorry, I'm not going out that easy. I will make sure my voice is heard again. Guess who's back, bitches?
We're so happy and grateful that Pat's going to be able to use his voice again to continue to speak for the ALS community and rally support for the cause.
We're already working on turning this into a larger program so that if you're diagnosed, you can record your voice and use it in the future. That way you will always keep that unique part of yourself, your voice.
If you have ALS, it's crucial that you do not wait, and that you start backing up your voice while you still have it. Thanks to Project Revoice, I can finally speak freely in my own voice again. It's changed my life forever.
Hi everyone, my name's Doug Goldman and I am the Business Development Manager in the Skilled Nursing Division at Maxim Healthcare Services in the San Diego office.
Hi everyone, my name is Paloma Martinez and I am the Business Development Manager for the non-medical business line in Maxim.
So today we're going to be discussing some things like resources in the community and the differences between hiring privately caregivers versus the benefit of utilizing an agency. And we just want to make it fully aware that this is an open forum, so please feel free to stop and ask any questions at any time. And again, this is more about the industry and what's available, not just specifically Maxim, but we are going to obviously touch point on Maxim's resources and utilize us as an example about what sort of resources agencies can provide.
Thank you, Doug. So I will take it away now. So like I mentioned, I do work for the non-medical business line at Maxim. We understand that ALS, it can be very, very challenging, and there's going to be a point where a family member will need that support of a caregiver. So what are we going to do? So they're going to say, okay, where do we go? Where do we go from there? So you have an option to either go with a private caregiver that you pay out of pocket, or you can go with an agency. There's ups and downs when going with a private caregiver. Some of the issues can be, okay, so who is this caregiver? Do I have to go with this caregiver because I need her and the budget, and so on. So I'm pretty sure that maybe someone has gone with a private caregiver and issues have arisen. For example, maybe that caregiver is not the right fit for your loved one, or say, for example, her availability is not up to par, or maybe something went missing in the home. Not only that, but it's also a burden to the family and the loved ones when, choosing a caregiver. They have to take time out of their busy schedules, taking time from their loved one, going online, maybe searching on Craigslist or even on the news. Yes.
Okay, so now you're scaring me. This is a very personal hire, and to find somebody on Craigslist would probably be a very lousy idea.
Right.
We recommend referrals, background checks. Take it very seriously. You're letting somebody come in your home. It's a big deal. It's time consuming. And the whole payroll thing. You got to get it right.
Yep. Right.
Not to scare anybody, but we had a family who did it wrong, ended up before the labor board and had a $10,000 situation. They were paying in cash, no records, no receipts. So the caregiver told the labor board, I never got paid. The family couldn't prove they paid. Yeah, it gets messy.
Yeah, it's a true mess. You brought up a really good point. Payroll. With going with an agency, we take care of payroll, we take care of background checks. An agency will have their caregivers live scan through the state of California. They go through a very intense hiring process, compliance trainings, and so on. I've heard multiple stories to where they've had those issues with payroll. And of course, the background check is very important. I myself, I'm a very private person. So, bringing someone into my home who knows? You see a lot of stories in the news. So it's very, very important to know who is coming into your home and caring for your loved one. And again, that person is in your home where all your valuables are. So you want to make sure that candidate is very qualified for that. Yeah. So that's where the agency comes in. We do the interviews, we do the hiring, we do all the credentialings to make sure that you're having quality out there and not just someone that's sitting on the couch staring at their phone. I've heard that a lot. So I feel like if I were in need of services, I would definitely go with an agency that would help me out and my loved one.
Yeah.
And not just that, but say, for example, you do hire a private caregiver and she's working out great and everything is fine, and she accidentally hurts herself. Who's going to help with that, So an agency, when you go with an agency, we take care of all of those things. They are insured, covered, and bonded through workers' comp. If something is lost or a caregiver is helping out with, let's say, for example, light housekeeping, a glass breaks and it's super expensive or whatever breaks, Maxim would take care of that, or any agency will. So that's, the pros and cons in regards to hiring a private caregiver and going with an agency. Not only that, but most agencies do offer meet and greets prior to starting care with your loved one. So when you hire an agency, you're going to have all of those, incentives. So you can interview your caregiver, see if that would be a good match for your loved one and the family, of course, and then move forward with that. Any questions so far?
Well, the biggest question tends to be up the front of this process. How do I possibly pay for either option? Right.
So we pretty much accept any form of payment. It can be private pay, long-term care, TRICARE. We do have a list up with all of the insurances that we accept. So pretty much any insurance. So like I said, whatever it is that the consumer has, we can work with it.
How do I access that element of my insurance? You know, I'm used to getting rejected on everything I ask for.
So that's why you go with an agency, so that you don't get that rejection. We handle all of that. You know, there's a lot of families that get no's with us. We would take care of that.
Yeah,
We're going to relieve that stress from the family.
Exactly. So we relieve the burden of having to deal with insurance companies, having to deal with payments, timely filing of proper payments, things like that. If you get denied originally, that's what we're here for. We appeal to the very end. We never take no for an answer. We channel through all the appeals processes. I'm working with a couple of patients right now who've been denied primarily by their primary insurance, and we've moved through first and second level appeals, and we put together really good packages to prove why it's essential for their insurance to approve of the services, and why it's necessary, and why the patient or client needs these sorts of services, all the way to the state level. At the Department of Managed Healthcare or the California Department of Insurance, we take on that burden because we know how difficult that can be, and we want you guys to focus on taking care of your loved ones and living as great of a life as you can while we handle all the rest of the stuff.
Yes.
Excellent. So I'm new to all this. Mm-hmm. All of a sudden, I need help in the morning. I need help in the evenings. I don't know where to begin. I mean, who on my medical team helps me develop, I hear this term, care plan? Is that an important document? Is it a suggestion? Educate me. I don't know anything.
So it depends what level of care you're looking for. So if you are requiring like through our agency specifically, if you're requiring a skilled level of nursing care, your primary physician will work with our team of registered clinicians who oversee the shift care nursing and oversee the plan of care and help create a plan of care in conjunction with your primary physician that gets signed and that we follow the orders with.
Okay, so I go to for example, a certified center of excellence for ALS at a clinic. Mm-hmm. My primary care physician isn't there. I still go back to them for the care plan?
So sorry, I misexplained. Okay. So basically what happens is after we access your insurance and we come to the approval, because we're only going to do approvals. We don't accept denials here, right? So once we get approved by your insurance, or if you decide to pay privately out of pocket, our registered nurse comes out and visits your home and does an initial assessment. They gather all the information that you have. What kind of medications are you utilizing? How frequent, if you're on a ventilator, how frequently, or what are the settings? How frequently are you getting suctioned if you have a trach? How frequent are your G-tube feedings throughout the day? And our registered nurse takes all that information. They draft it into what we call the plan of treatment. And then they send it over to your primary physician without you having to even visit your doctor. And the primary physician reviews this plan of care, and if they agree, they sign off on it and they send it back to us. And then that's the plan of care that we provide to the skilled nurses to provide shift care nursing while they're out at your home. Now,
so that's great. So if I'm totally lost,
yeah,
I can start with you guys.
Absolutely.
Get that several hour in-home assessment. Is that what you guys call it?
Yes.
Yep.
And then if my doctor, my primary care physician, not my neurologist, my primary care physician signs off on it, then we've got a tool to work through the system to try and get it funded.
Absolutely.
Without that document, not much happens, right?
It depends. So
it's easier to have it.
Absolutely. It's definitely preferred that we start that process so that we have more proof in the pudding of why the services are required.
Right. Because my goal up front is to get my insurance to cover this cost.
Absolutely.
Okay.
Yeah.
Right. And then for non-medical, the process is a lot. It doesn't entail a lot of paperwork and going back and forth. If it's just a companion, someone, to be out there helping the family and the patient, it's pretty much, we also do the home assessment. We filled out the plan of care and so on, but we can pretty much get started right away because it's non-medical. Basically, we're going to be helping out with ADLs, maybe bathing, and whatever is included in that plan of care.
Is my insurance going to cover that, typically?
It depends on the insurance. For non-medical, it will depend. We do accept long-term care insurance, also private pay, and then of course when it gets to the level to where it requires skill level care, then this is where the rest of the payers come in.
Yeah. So, and yeah, up on the screen is a list of all of our contracted in-network insurances. We're just about contracted with every insurance out there possible because we want full access to care for everybody. So anything that we can do in our contracting division to make sure that we've reached every insurance company available is what we do. And then I'm going to steal your thunder and let them know that in 2019, for those of you who are Medicare eligible, there's not a lot of details on it yet, but they are adding a non-skilled benefit for Medicare beneficiaries to receive CNA level of care, shift care nursing in the home as of 2019. So definitely stay tuned for that also.
Okay, what's CNA?
CNA is a certified nursing assistant. So they typically perform with the non-medical side of nursing.
Right.
Helping me get up in the morning.
Yes,
Absolutely.
helping you get up, personal care, brushing your teeth, making you look handsome for your family, ready to go. So that's pretty much what we do. And then also...
So you do miracles in my case?
We do miracles. Yes.
Miracle makeovers.
Yes. And then I'm going to go back on pretty much on the beginning. It was just something that I was just thinking about now. Also, if you were to hire a private caregiver, say she doesn't show up, what's going to happen? You don't have a plan B. So with going with an agency, for example, with us, we have a full team of 16 healthcare coordinators in the office. We have a lot of providers on staff. We have over 600 providers on staff. So if anything were to happen, your private caregiver, someone calls off, or you just need that extra pair of hands out there in the home, you will call an agency and they will get someone out there immediately to help you out.
Yeah, so just to add on to that, by the providers that she's talking about, that includes certified nursing assistants, home health aides, registered nurses, licensed vocational or licensed practical nurses, caregivers who are registered with the state. All of those fall under our requirement for provider, and we do have over 600 active throughout all of our divisions. So again, like Paloma just said, if you decide to go privately without utilizing an agency and, God forbid, your assistant gets sick that day, or her child gets sick, or his child gets sick, and they can't make it to work for whatever reason, chances are is that, you don't really have a big pool to call and for backup, and it's not like you can really just skip a day without having these sorts of services because, it's going to affect your daily life. So that is the benefit of having an agency. We do have the ability with our team of 16 recruiters who make phone calls, and they get that coverage immediately as soon as we are found out. And even furthermore, we're a 24/7 live answering company. We don't have voicemails. We don't have direct lines. Everybody answers at all times. We have on-call coordinators to assist with the staffing after hours. So in the event that it's 2 minutes before your shift and they were supposed to do a 10 p.m. shift until 6 in the morning, and they call at 9:45, our on-call coordinator is going to troubleshoot and get you that backup. So that is the safety net of an agency. So.
Right. And then also to touch upon, say for example, there's anyone out there that is inquiring for services and they are looking to pay out of pocket. Pretty much the private pay rates can be a little up there. What we are offering for ALS patients is a discounted rate of $25 an hour. The rates can vary from anything 28 to 35 an hour. So if there's anyone out there that is in need of services and you're looking to pay out of pocket, just know that there is a discounted rate that we're offering of $25 an hour.
And what's your minimum number of hours if they come to my home?
That would be a 2-hour minimum.
2 hours?
Yes.
Most people are 4, right?
Yes.
Yep.
Okay, so that's a really, I only need a couple hours in the morning, and I got to pay for 4. That's a hardship.
Exactly.
Okay, so 2 hours.
Yes.
So I mean, how does that work? Let's say I need to get all the stuff you talked about done, and we're done in 70 minutes. Do they stay and do other things, or how does that work?
It's completely up to the family. We can pretty much help out with everything. We know that the family, it's there supporting their loved one, so they may need, that extra pair of hands. So it will be nice for wife or mom to come home and the dishes are done, or laundry's done for them. So if there's any extra time available, there's always something to do.
And that's kind of part of your program.
Yes.
The caregiver knows, okay,
yes.
You got 50 minutes. Ask if you can do.
Yes, you always want to stay productive and find something to do
Awesome.
to assist the family.
Okay. Cool.
Yes.
Cool.
Yeah, so I'm going to move on. Or you're all set? Okay. Mm-hmm. So I'm going to move on to the part about the skilled nursing division that I primarily focus on. So not everybody's there. And some of you guys may require skilled nursing services, and when I say skilled nursing services, I'm specifically talking about an LVN or RN, licensed vocational nurse, or registered nurse level of care. So in the event, so our basic requirements to for us to access an LVN or RN to provide services is G-tube feeding. So if you require G-tube assistance with G-tube feedings, site care, things like that, that's where our LVNs come into play. Like I said, not everybody's there yet, and not everybody gets to that point. But in the event that you are, our licensed nurses are fully trained, just like the companion division. They go through compliance training. We do our background checks. We do a thorough interview process. We, just like companion services, we offer complimentary interviews, or what we call meet and greets, so that you can judge the character of the nurse that we're going to send out to your home and see if they want to, if they're the right fit for your family or the right fit for the patient, etc. And so on and so forth. So as we move up into higher level of care like trach management or ventilator dependencies, we are fully equipped and train all of our nurses to actually perform hands-on trach and vent management in the home. A lot of agencies, and this is where I'm going to specific to Maxim, a lot of agencies don't really have the same training program as we do. We specifically have teamed up with Johns Hopkins University School of Nursing, and we've created a home mechanical ventilation training program. Every single one of our LVNs and RNs who get hired on to perform skilled nursing shift care in your home is mandated to take those requirement courses before they even move forward in the interview process. So before they're officially hired on, they have to take these online modules along with our award-winning compliance training program modules, operational orientation, and clinical orientation, so that they are fully prepared and trained before they go to your homes. We do not send anyone out without doing that. So I just want to make that clear, that before any candidate comes to your home, they are 100% trained in the exact same way as every single nurse or caregiver that comes on board with Maxim Healthcare Services. Yeah.
So how often do I see, like, the nurse who came out and did the care plan or other people checking on what's going on?
Good question. So in our home care division, where we offer skilled nursing, we have a team of 5 clinicians. Each clinician oversees approximately 20 to 30 patients, and every 30 days they come out for a supervisory visit to do a 30-day check-in to make sure the plan of care is being followed properly, to do an observation of the nurse to make sure that he or she is following the plan of care properly and performing the tasks and responsibilities efficiently. They chat with the family member to see if there's been any changes in condition, any updates to medication, any changes in the ventilator features or things like that. And then every 60 days, the nurse comes back out again to do what we call a recertification visit, and that's like a federal and state law that every 60 days they go and they recertify. So they basically, they review everything, put all the plan of care together again, get it signed by the doctor again every 60 days to make sure that we are continuing the proper care in the home.
So it's not terribly frequent, but sometimes the rate of progression is fairly aggressive.
Right.
You guys accommodate that and update that care plan more often when you're getting feedback that, hey, what's needed here is more?
Absolutely.
Explain how that works. Or?
So the clinician that I just spoke about, they only come out to the home every 30 and 60 days, but the shift care nurses who work 8 to 24 hours a day, 5 to 7 days a week in your home, it's their responsibility to assist with supplemental orders. So if there is a change, or we have to increase your prescription antibiotics, or we have to decrease them, or there was a change in the ventilator settings, or there was a change in condition, or there was an admission to a hospital, things like that, it is the shift care nurse's responsibility to report that to the office, to our team of clinicians, so that our team of clinicians is fully aware of any changes, and that they come out to do resumptions of care in the event that there's a discharge from a hospital or readmission, things like that. So we do have availability to have LVNs and RNs in there 24 hours a day, but the clinicians just do their random check-ins every 30 and 60 days. And obviously weekly or daily or as needed when the shift care nurse reports. So
terrific, thank you.
Yeah, and then just to add on to the trach and vent management, we were hoping to show a quick 2 to 3 minute video of what Maxim Healthcare Services and Johns Hopkins School of Nursing has done in partnership to create this home mechanical ventilation training program. So in this video, you'll see what it looks like, what a patient's bed, or we call it a hospital at home. So what it looks like at home, we provide acute care in the home. So it's going to be really interesting to see this video clip and everything that they show. So cue it away.
Resuscitator, cuff trach, cannula, pulse oximeter, SGAs are just some of the terms and equipment that you will encounter when working with a ventilated patient. After a ventilated patient is stable enough to come home from the hospital, there is a need to set up and maintain a variety of complicated equipment. This can be very difficult for a family to maintain, but a nurse with proper training can assist the family and increase the likelihood of successful outcomes. This is why Maxim Healthcare Services, a leading provider of care for trach and ventilator patients, in partnership with Johns Hopkins School of Nursing, has developed an innovative online home mechanical ventilation, or HMV, training module. This new module is interactive and designed to prepare nurses for their in-person competency evaluation. This training module allows an HMV nurse to review content in a dynamic, low-pressure environment.
Johns Hopkins University School of Nursing and Maxim Healthcare share the same passion and desire to ensure that our patients receive optimal care and achieve the best outcomes.
As a potential patient, as a parent of a child that is trach and ventilator dependent, or even as a referral source, we know that you want to have the most competent nurse in the home.
This 60-minute course can be taken on a personal computer at the nurse's convenience. After completing the training, caregivers possess the skills and confidence to better care for their patients.
I like the fact that it times you out, that it actually puts you in a real life scenario. It really gives you all the tools, it gives you all the information, the plan of care, it gives you all the patient's background, and then from there you're going to go in and you're going to assess a situation.
It provides the nurses with a leg up in their careers to have a better understanding and increase their skills in the home.
Maxim's online HMV training module is already making a positive change in the lives of patients, the patients' families, and caregivers.
I'm so excited about this training module and the confidence that it's going to build with our nurses who are taking care of the trach and ventilator patient in the home and managing these emergency situations. And I'm equally thrilled about our partnership with Johns Hopkins School of Nursing.
We hope that this education program will provide Maxim nurses with the knowledge, skills and competencies to be able to react and respond to a deteriorating patient.
Take your training and your career to the next level by becoming a Maxim nurse. Learn more at info.maximhealthcare.com/nurses.
So, I know what everyone's thinking is a 60-minute video really enough to train a nurse to do trach and vent management in the home? And no, it's not. So that's the short answer, but what do we do about that? So as part of this, after they complete this 60-minute training video, they're required to shadow based on their competency and how well they perceive this training program, anywhere from 40 to 80 hours of direct hands-on shadowing with an already experienced trach and ventilator certified nurse prior to them even coming to our office to get comped out on being permitted to work on a trach or ventilator patient. So aside from the 60-minute video, we also have, like I said, the 40 to 80 hours of hands-on shadowing that really drive it home and make everybody prepared before they're going into an environment like that. So
how many hours do you typically see insurance approve for different stages of ALS? Can you just kind of give a generalization?
Yeah. So typically, a lot of ALS patients are veteran affiliated. Our local VA here in San Diego currently approves for up to 56 hours a week, which is 8 hours per day, 7 days a week. Those hours can be used whenever you feel appropriate. So if you think that you need someone in the home from 8 a.m. to 4 p.m., 7 days a week so that you can go to work and your loved one can be taken care of, we find nursing staff for that, and the VA here locally approves of those amount of hours. The insurance, other insurances like Anthem or Blue Shield or Aetna or other things like that, that can totally vary, depends totally on your specific insurance policy, but it could be anywhere from 40 hours a week to 24/7 care. So, and that's figured out when we find out your insurance information.
Or zero.
Or zero, yes. Yeah.
So if I'm a veteran hearing this, call you guys?
Absolutely.
And let you fight with the VA?
Yes.
Absolutely.
And if I have, some other insurance or I'm Medicare with supplementals and administered by Molina, call you guys.
Yep, call us, whether you have Medi-Cal, VA insurance, Anthem, private pay, state funded, Medicare, anything it is, we have access to assist you with your authorization, of course, and we totally will relieve you of that burden. So,
what if I'm Medicare, Medi-Cal?
Yep, same thing. We can still assist with that.
Okay.
Yep.
How does in-home support services fit into this, or does it?
So I guess that depends if you have state-funded insurance. So if you do have Medi-Cal, it all comes from in-home support services. All comes from one giant pool of hours. So you can't have more than obviously 24/7 approved. So if you decide to use IHSS services for a direct family member to get paid for being a caregiver, that will take away from your Medi-Cal hours of what they will approve. However, Medi-Cal does approve, depending upon how you want to use it or what you want to request, up to 156 hours per week of care. So, but the IHSS does come into play. It is all pooled together into like a lump sum of hours, and you can decide specifically how you want to access those hours.
And if I'm in that situation, for IHSS, the caregiver is paid, really low.
Mm-hmm.
Do you guys get a better rate from them, or how does that work?
So we have established rates, which actually every agency in the state of California has the same rates with Medi-Cal. In past experience, the rates have been super low, just to be quite honest with Medi-Cal. And it's public information that I can share that for skilled nursing level of care, LVN and RN, they only reimburse home health agencies $29 an hour currently. So with that means we can only pay LVNs and RNs $18 to $20 an hour, given our overhead cost and our burden of obviously turning on the electric and operating and having a team of recruiters and clinicians and things like that. Now, in better news, in July, Maxim Healthcare Services has partnered up with Governor Jerry Brown, and effective July, as God willing that it gets passed by CMS in June, they're going to, for the first time in 17 years, since 2001, give a 50% reimbursement rate increase to home health agencies in the state of California, where the reimbursement rates will increase for LVN level of care up to $40 an hour, $44 an hour actually, and RN level of care up to $60 an hour. So the benefit of that, which first of all, after 17 years, it's about time, right? Mm-hmm. And besides that, all of these nurses, the average salary for LVNs and RNs in the San Diego market is anywhere between $25 and $50 an hour, depending upon what setting. A lot of our home care nurses over the years have left our industry, and they're working in skilled nursing facilities and assisted livings because they can pay at higher rates. So the benefit in this is we're going to be able to provide way more care to those who we can't currently find nurses for the right amount to fit into their home and their schedule and things like that. And we're also hopefully going to bring back in a lot of the nurses back into our market to get back into home care where their original passion was, because now we can compete with the average market salaries. So,
and they get the flexibility of the schedule that your industry provides, that maybe another facility says, look, we want you here Monday through Friday.
Exactly. Yeah, so
that's the trade-off for them.
Right, and yeah, so to flip over to like the benefit of a nurse working for an agency is that, like an agency like ours, we're considered per diem. So you could work one shift a week, you could work 40 hours a week, you could work weekends, you could work holidays, you could not work weekends or holidays. So just like our family members who have the safety net of an agency, our caregivers also have the safety net of an agency in regards to flexibility and insurance and benefits and things like that. So,
got it.
Yeah,
terrific.
Any other questions at all? No? All right. Well, if you guys do have any questions, feel free to reach out to us. And again, I'm Doug Goldman at Maxim Healthcare Services.
And Paloma Martinez.
Yep.
And we have a prior webcast with one of your associates. Can you tell us about him?
Drake. So Drake Martin Green, who unfortunately couldn't make it today. He is our San Diego County Business Development Manager. He has made a major imprint in this market over the past few years that he's worked here at Maxim Healthcare Services. This hits very close to home for him because growing up, he grew up with his grandmother who unfortunately turned a little bit ill. And he took a heart to healthcare, and just like us, and it's been his civic responsibility to assist all the patients in need, and he has done one heck of a job doing that. He's taught us the appeals process. He's taught us how to access insurance. He's found resources in the community for all members here in the community ever needing resources. And if you guys do have any questions or concerns that I'm unable to answer, I am positive that Drake will definitely have that answer. So,
yeah. All right, so shout out for Drake there.
Yes.
Yes, shout out Drake.
All right, so thank you for logging in or attending our Care Services meeting. We thank you all, and we'll see you next month.
Thank you.
We'll see you in June.
Oh.
Yeah, so let me
We'll
make
see you
a
then.
plug. May 7th, instead of coming to this beautiful conference room, on May 7th, we're going to be on the USS Midway.
Wow.
So please RSVP to our office if you and your family want to participate in that Care Services meeting.
Yep.
Okay.
That'll be fun.
Thank
We're done.
you.
Thank you.
Thank you.